Well, this holiday weekend, we're checking in on our Maryland veterans, shining a light on mental health issues as part of TV11's Peace of Mind campaign. And joining us this morning is Dr. Aaron Jacoby. He is the director of Maryland's VA's Mental Health Clinic Center. Good morning, and thanks for being with us today.
Good morning, Jennifer. Thank you very much for giving me the opportunity to meet with you this morning.
It's such an important topic, and every day can be a struggle for veterans, but especially holidays like Memorial Day and Veterans Day can be very particularly difficult. Can you talk about why that is?
Yes, many of our veterans, as you know, have served overseas in combat, and they've also engaged in very dangerous activities stateside while serving. And many of our veterans are at greater risk of developing post-traumatic stress disorder, PTSD, as well as depression and substance use disorders that are often comorbid. So the symptoms that they typically experience related to those conditions are often really triggered by the memories that are brought up during Memorial Day.
And particularly memories, I would imagine, of maybe their fallen comrades, people that they serve side by side with out in the field.
Indeed. When I meet with my veterans, a lot of times they'll talk about times that are very horrific. And this holiday really brings back many of those memories. It hits them very deeply. It's often challenging for our veterans because civilians are often celebrating the holiday with picnics and family celebrations. It's a very solemn time for many of our veterans.
So many people have been going through things during this pandemic, but what are some issues that are very specific to veterans during this time period?
Well, the pandemic really was a story in three acts for us. As you remember, back in March and April of last year, there was a tremendous amount of shock. We were, as a nation and as a world, really overwhelmed by the pandemic. And our veterans, even with their training and their expertise in handling traumatic situations, were impacted as well. Initially, we made sure that we made the veterans feel as safe as possible within our facility. We did everything that we could to do that by using universal masking and social distancing. And then we also made sure that the second act was really getting folks vaccinated. Um, Veterans in particular were experiencing anxiety and depression. Those symptoms were heightened and expanded during the pandemic. The fears that everyone had in the nation really triggered some of those bad memories that they had, making it very difficult for them to handle just everyday existence.
And sometimes drug use can be a coping mechanism, so can alcohol, and getting help for that during this time period has been difficult. So what are you doing to make sure the outreach is there?
Well, one of the things that we did as a clinical center and as a hospital, we pivoted very quickly. We made sure that we would reach the veterans and we increased our use of telemental health services and telehealth services overall. To give you some perspective, last April, we had conducted about over 5,000 visits. This past April, we had conducted over 50,000 visits. And so we increased by over 1,000%. And as a facility, we were able to reach out to veterans to make sure that they remain connected to care. We also made sure that people who needed to be seen in the hospital for treatment did so in a very safe manner. And so, as mentioned before, we used universal masking, social distancing, and then we had a really robust vaccination program once the vaccine was available. The veterans really received that well, and we've been able to vaccinate our population at really high rates.
And it's, I think, a misconception to think that every veteran is connected with the Veteran Affairs. So if someone's watching this right now and they want help, how do they get it?
Great question. So it's easy. They can sign up online. They can go to our website, which is www.maryland.va.gov. They can click on a button there and fill out an application. They can also come into our facility. We're welcoming veterans every day, enroll in care. They can also reach out and contact the Veterans Crisis Line, which is 1-800-273-TALK-8255. So there are multiple ways that people can get connected for care.
Excellent. Aaron Jacoby, thank you so much for joining us this morning. Certainly appreciate it. Great information.
Thanks so much. Have a great day and a wonderful and safe holiday weekend.
You as well. And let's